Well, for a while, we've been telling you about the cosmetic drug Botox and its recent FDA approval. The promise of less wrinkled brows and faces, even ridding persistent headaches. Botox has been a multi-use drug. Dr. Brent Reed of Griffin and Reed Eyecare joins us live to explain the use of this drug and its success rate. Dr. Reed, welcome.
Thank you, Walt. Good to be here.
How does Botox work? It's almost like this cure-all elixir for a bunch of different things now.
It is. It has a lot of different applications that seem to be very useful. The way Botox works is basically the same toxin that's created by the bacterium that's in poorly processed foods. And the way a muscle contracts is there's an impulse that comes from the brain down, and it's almost like a junction between two railroad cars. Here's the nerve, here's the muscle. There's an impulse that crosses between the nerve and the muscle through what's called a neurotransmitter. Botox interposes itself between the nerve and the muscle and basically blocks that neurotransmitter. And it blocks it for a period of between usually 4 and 6 months quite effectively, preventing the muscle from contracting.
So recently we learned, I mean, obviously it's been used for cosmetic use for wrinkles. Now we know it helps with migraine headaches. And recently, injected under the arm can stop you from sweating. I mean, where is this going?
We don't know. There's a lot of potential great applications for it. It originally started actually in the 1970s with the use of the purified toxin in treating kids with crossed eyes. Basically in situations where there wasn't enough crossing to actually do muscle surgery, but you could actually straighten the eye by weakening the muscle that was pulling too hard. An injection would be given into one of the 6 muscles that move the eye. The eyes would straighten for a period of time, and then 6 months later it had to be repeated, but it was much better than performing surgery in some cases.
So you're using that obviously with the eyes. Is there anything else Botox? You folks were actually, as you mentioned, the first to use it.
Yeah, there's a couple of other applications that actually started early on, and that is some people are afflicted with certain spasms of facial muscles that they have no control over. Blepharospasm, for example, is a condition where you actually forcefully are forced to close your eyes, and it happens involuntarily at the worst times. Once treated a highway patrolman who had that condition, and by giving him Botox he was able to continue to perform his job. Otherwise he'd be forced off the road because he'd never know when his eyes would close.
How about any side effects people need to be careful about?
Basically, the side effects are related very much to the thing that the drug does. If too much is applied in the wrong place, and the anatomy is not well known by the person applying it, then you can get a crossed eye. For example, if crow's feet are being treated and too much is given and migrates in where the muscles around the eye are, it can get a crossed eye. A droopy lid on one side, basically ptosis of the face, or lack of facial expression on one side, with a drooping of the mouth can happen if too much is given for small wrinkles around the mouth. So it's primarily side effects related to those things. Nursing or pregnant women shouldn't be exposed to Botox toxin, and that's basically it, Walt.
Dr. Brent Reed, we thank you as always. Always nice to visit with you and some of the amazing uses of Botox these days.
Pleasure, Walt.